The AIDS epidemic continues to be a major global public health issue, and a World Health Organization report for the year 2021 shows that 1.5 million people died of HIV-related causes, with an estimated 38.4 million people living with the virus, 2/3 of whom live on the African continent. AIDS is listed among the leading causes of death in sub-Saharan Africa, which is the epicenter of the AIDS epidemic. The home to 1.4 million people living with HIV recently approved use of dapivirine vaginal ring as an optional prevention choice for women at substantial risk of HIV infection. The ring is made of silicone and has an antiviral agent that is able to prevent HIV infection by releasing the antiviral drug dapivirine from the ring into the vagina slowly over 28 days. Dr. Daniel Byamukama, the head of HIV prevention at Uganda AIDS Center, says the dapivirine ring may be a game changer in their new strategy, focusing on treatment-based remedies to the AIDS epidemic, especially among women and girls who made up almost 2/3 of new HIV infections in 2021.
The main treatment we have been giving is oral. They are tablets you swallow. But we discovered that those tablets were having a challenge. Many people, especially women, were having a challenge because of the issues of social society. The woman, usually the men some of them would be violated by their husbands. So we discovered that women need a discreet method which they can use. If the husband is not consenting, it's okay, they can still use and have privacy. So we have fortunately come up, or research has come up with 2 methods. One of them is the dapivirine vaginal ring. It's a ring which a woman inserts in her private parts and pushes it up. It goes around the cervix, what is called nabana in Uganda, and it stays there for a whole month. It increases her chances of not contracting HIV in case her partner contracts HIV.
Richard Hasunida, an HIV/AIDS advisor for the health rights group Coalition for Health Promotion and Social Development, says the dapivirine ring is a very important innovation due to the flexibility in its use and related benefits.
This is a very, very important innovation. It's very important for 2 reasons or more. That one, it is a women-controlled tool. Remember, women are more vulnerable to HIV for very many reasons, including gender violence and issues related to their dominance. And then we have the other reason is that it is not, you don't have to use it every morning, because we have found a problem in adherence to ARVs that people must be reminded to take a tablet every day. And when you bring a product that people can use once in a month, insert it and forget, that is a very big innovation.
Musenero Beatrice, a married woman and resident of Kalangala district, the area with highest prevalent rate of HIV infections in Uganda, says she has been using PrEP as a prevention measure against HIV infection, but she has had trouble trying to conceal the pills from her husband, and at times she forgets taking the pill or skips the schedule for fear of retribution from her partner.
At times you forget. You are always under pressure to go home and take the pill, and at times I miss. Secondly, Some people fear being seen buying PrEP tablets.
Kawali oyagala PrEP naye banaakulaba batya buli lusaawa ng'ogendayo okufuna agamakerenda. Ne mu nnyumba omusajja nze kwegamba nze nkweka makweki era gye ngateeka. Mba saagala omusajja akole ki?
I actually hide the tablets from my husband because he may misinterpret PrEP tablets to ARVs and think I am HIV positive.
Dr. Byamukama reaffirms that Beatrice's condition is not an exception, and it is a reason for high prevalence rates of HIV infections in women in Uganda.
From our culture perspective, women are always marginalized by society. They need permission from their husbands to use any prevention methods, especially like the pills. And we have discovered that many women get violated when their husbands discover. They will call you a prostitute if your husband discovered you're taking oral PrEP. So we find women have a disadvantage. And it explains why there are more new HIV infections among women than men. But we believe that the pivotal ring is convenient for a woman. Number one, it is long-acting. You put one ring per month. So the woman doesn't have to bother the husband looking for money or for permission to go to the health facility. So it works over a month. Number two, it is discreet. Once it is inserted by the health worker or by yourself, nobody will know that you have your method that's working for you. So we believe the prevention gap, which had left women behind, will be resolved by these discreet means, because we know one of the challenges why they are not using prevention is because of our society norms. Women don't have money to come to the hospital, or they have to explain themselves every time they come to the hospital, or they have to explain themselves every time they have seen swallowing PrEP. So we believe it will be beneficial for women. It is convenient, especially the injectable PrEP. It is highly effective.
In order to achieve full acceptability for this new innovation, Hasunira recommends that authorities in Uganda should conduct adequate sensitization about the benefits of the dapivirine ring, but also says government should embark on building capacity within health workers in order to optimize its coverage.
The dapivirine ring is coming in not to replace what is already being used. We have tools that we're using to prevent HIV. This one is a new innovation. It only adds to what we have. So the messaging should be very, very clear from the people who are going to administer this. It should be that this is coming to complement other methods. So it should not be used in isolation because it is not 100% effective. It reduces your chances, but it doesn't actually protect you completely. So you should use it alongside the condom. You should use it alongside, you should even use it alongside faithfulness.
He also stresses the need by authorities to address the concerns around quality and safety associated with this new product, but also ensure these products are available once the Ministry of Health rolls out programs for use.
The first issue that should be taken as serious, or that should be given attention, is public awareness. Let people understand these new technologies, because if they get second-hand information, that might be distorted. And we have seen this, that if I tell you and you're going to tell, and then the person you told tells, eventually the final person gets a very different message. Let's have these messages drafted by Ministry of Health. What are the key messages on this? We need to emphasize the issue of risk, that you need to perceive your risk, you need to understand your risk, that if you have a husband who goes and drives a trailer and is away for several weeks, understand that you are at risk.
Nakawunde Reste, the Vice Chairperson for Kalangala District Local Government and Secretary for Women and Gender, says adequate awareness and mobilization of masses is paramount ahead of the rollout of this new product. She also says that the government should target women above 18 years and avoid triggering laxity in teenage groups who are more vulnerable to HIV infections. She, however, notes that there exists a strong network for mobilization within local communities in Kalangala district on which government can rely.
Let's target 18 years and above and those who are in high-risk groups. We have focal persons who know where these people are. We will embrace the ring as long as the World Health Organization approves it. But communities must be sensitized about the effects of these drugs before the Ministry of Health rolls out this program.
As long as World Health Organization the Ministry of Health embraces it, side effects, communities before they are sensitized, especially those groups sex workers. Native sex workers, they are HIV positive, they are very negative.
So let people understand their risk. That's a recommendation in this awareness that the ministry should initiate. Let people understand and appreciate their risk. Once they understand their risk, they should seek these new technologies. They are available and they are free of charge to the user. And once we have done public awareness, we should actually then make sure these drugs are available when they are needed. We have had an issue with COVID vaccinations. People went vaccinated for the first time. When they went back for a booster dose, vaccines that they had taken were not there. And those people never came back. We lost that opportunity to actually prevent, to move the epidemic faster. So let's not do that. We should not have stockouts of these drugs. Once you introduce them into the program, into the system, let's have them available. And let's be innovative in reaching the people who are actually able to, who need them. Thirdly, let's build the capacity of our service providers to provide these services. The health worker should be able to understand what the Dapivirine ring is and how it works, because they will be the ones to answer the questions from the consumer, and then how to apply it, how to administer it. And they should know why it is 4 weeks. And if a person stayed away after 4 weeks, what are the consequences?
Dr. Byamukama believes that there will always be concerns about quality and safety associated with new technologies, but he also gives assurance that relevant local and international authorities have done due diligence to ensure quality of products and the safety of the users.
Yes, of course, with every drug, with every medicine, there are concerns of quality, there are concerns of safety. But as a government, we have an institution called the National Drug Authority, which is there to ensure that the drugs are available to us, pass the prerequisite checks. So they have been, by the time they get approval, it means the National Drug Authority has done due diligence on behalf of the government, and I can assure you the National Drug Authority has already done that. So we are confident that they are appropriate for our people to use. And even when they come, they keep on doing due diligence to make sure that the drugs are of high quality and are safe for use by Ghanaians. So we are not worried. There may be a risk of misinterpretation. We always face this, If you look at the dapivirine ring, it's not 100% effective. But for us, from the public health point of view, it is better than being exposed with no any protection. So we believe if we add it to the tools we have in the country, it will significantly contribute to the reduction of HIV at population level.
Dr. Byamukama also notes that authorities in Uganda are finalizing procedures and plans to have the dapivirine vaginal ring available for use in Uganda before the end of this year.
The other new tool which science has brought for us is the use of an injectable. We can give you an injection once a month, and it's quite highly effective. The injectable is highly effective. It's the one you call long-acting cabotegravir. It's an injection once a month, and it really protects you. You don't have to go through the trouble of taking pills for pre-exposure prophylaxis. And in our current planning, we are planning to make those two services, the ring and the injectable PrEP, available to our Ugandans. So by starting of 2024, by the end of this year, those services will be accessible to Ugandans. So we urge all Ugandans who consider themselves at risk to use these services.
The research and study on the dapivirine vaginal ring demonstrated an HIV reduction of 38% among women, and the ASPIRE study puts the dapivirine vaginal ring at 27% reduction in risk. Research is also underway to develop a vaginal ring that includes both contraception and HIV prevention. With this and other innovations coming, there is light on the horizon.